All right. Welcome, everyone. I will call to order the Yamhill County Board of Commissioners formal session for, what's the date today? October 24th, 2024. It is 10:01 in the morning. And Commissioner Sterrett, would you please lead us in the flag salute?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right. Anything to add to the calendar? We've noticed the executive session for next Thursday.
Mhm.
Right. Anything else to add? Anything AOC related?
Well, LGAC's tomorrow, but that was already noticed.
Anyone attending the Regional Solutions meeting today? Okay. Somehow that didn't wind up on our calendars. All right, if there's nothing else for the calendar, item D is public comment. This time period is reserved for public comment on any topic other than an agenda item, a quasi judicial land use matter, or a topic scheduled for a public hearing. So if anyone in the audience has comment on anything that is not related to an agenda item, now's the time to come forward, or if you're online, please raise your virtual hand. And if you have comment on something that is on the agenda, then I will call for comment when we get there. Okay, seeing and hearing none. We will move on to, and I do want to acknowledge a written comment that we received. One of them was quite a lengthy comment from Mrs. Turgeson. I'm going to, Dr. Turgeson, though, you're going to speak to your, okay, I was going to read it, so I'll let you go later. Okay. It's very thorough, so I really appreciate that. All right, so we will move on to item E, which is our department update. And we are joined today by our Economic Development Director, Joya Goodrum. Welcome, Joya.
Good morning.
Welcome.
Thank you.
Good morning.
This is a little high. My feet can't even touch the floor. Oh, my goodness. Okay, there we go. That's better. Okay,
Welcome, good morning.
thanks. All righty. Good morning. Thank you for providing me the time to present to you an update on the county's Economic Development Department. I want to go through a really brief history. Yamhill County has a long history of economic development programs involving a variety of organizations and agencies such as MEDP, SEDCOR, and the Duke Agency. To develop a better picture of the history of economic development in the county, I perused and researched really as much as I could possibly find. And here's what I have found. In the period from 2012 to 2013, Yamhill County contracted with McMinnville Economic Development Partnership to create a strategic economic development plan called Grow Yamhill. The plan was extensive and included data and recommendations to the county for economic vitality and growth in the area. In 2013 through 2014, Duke Agency was hired to develop a marketing strategy with printed magazine, online videos, and website, and staff were assigned to grant administration. In roughly the 2014 to 2016 timeframe, SEDCOR was hired to provide part-time staff to help with developing strategy moving forward and provide economic development services. Ultimately, the contract for services was awarded to SEDCOR. At that time, the Board of Commissioners adopted 2 of the strategies of the 4 that had been laid out in the Grow Yamhill plan. The first, retain, expand, and recruit businesses. And the second, identify and commit resources that will invest in Yamhill County economic development. SEDCOR performed that work until 2023, when the county opted to bring the economic development program in-house and hired me as the economic development manager. In this role, I wanted to make sure there was continuity for economic development, and therefore it made sense to me to follow the GROW plan, opting to implement all 4 approaches of that plan. The 4 strategies as outlined in the GROW Yamhill are: number 1, create communities ready to receive business. Communities in Yamhill County experience barriers to recruiting and growing businesses, whether it is, for example, infrastructure, land use laws, or local codes. These obstacles can be identified and removed to some extent to encourage economic development and business investment. This approach identifies assets and barriers to economic activity in the county. Strategy 2, retain, expand, and recruit businesses. Communication with business is vital to their understanding of resources and sustainability. The county can provide information, data, education, and resources to businesses seeking to remain or move to Yamhill County. This approach informs and educates businesses on resources to help them grow. Strategy 3, identify and commit resources that will invest in Yamhill County economic development. The county has resources in many forms, such as partnerships with other economic development agencies and organizations, financial assistance grants and loans, and connections to private funding sources. This approach provides opportunities for growth through funding and financial assistance, such as grants and loans and education. Strategy 4, develop and support vibrant communities. Yamhill County communities are diverse in population, industry, economic status, and resources. Given this diversity, understanding individual needs of each community and developing strategies to address those needs hand in hand with each community is the goal of this strategy. In the 15 or so months that I have been with the county, I have worked to address each area of this plan. Let me give you a synopsis of some of the work I have been doing for Yamhill County. To address strategy 1, I attend several monthly meetings to stay apprised of issues our communities face, such as the Parkway Committee for the Newburgh-Dundee Bypass, childcare initiatives, enterprise zones, and other state incentives for business, workforce development, business finance, and legislative issues. Some of the organizations hosting these meetings are Greater Portland, Inc., Business Oregon Childcare Infrastructure, and the LCDC. I'm a member of the Board of Trustees for Willamette Valley Medical Center, so I can understand how the hospital is addressing the needs of our community. I convened a meeting of leadership for the cities of Yamhill County, including representatives from Business Oregon and Grand Ronde, for a roundtable on what's happening within their respective cities. Some of the issues raised include water and wastewater concerns and meeting housing requirements. The successes included growth in their cities, such as new businesses, new schools, new housing developments, and investments in city properties. We have scheduled quarterly meetings through the next year to continue the conversations and updates. I'm working with the Mid-Willamette Valley Council of Governments on relaunching the county's revolving loan fund. It is an opportunity for us to support our local businesses with low interest rate loan from funds that are specifically set aside for this program. My research has found that in recent years, we have not used the funds because interest rates have been so low, so we couldn't compete. But now they're not. So this is a perfect opportunity for us to help our businesses grow and prosper. There is a bit over $200,000 in the fund, and loan amounts could be as low as $5,000. I've met with representatives from the Confederated Tribes of Grand Ronde and have established a good working relationship with a local council member and new director of economic development. I see great opportunity for ways we can work together for regional economic development. To address strategy 2, retrain, expand, and recruit businesses. Examples of how I'm executing this area are overseeing what is remaining of the $11 million in ARPA funds provided in several rounds of grants. All told, the amounts provided were $6.8 million to cities of Yamhill County for water and sewer projects, $2.5 million to not-for-profits, $180,000 in direct impact grants to small businesses, $453,000 for supply chain localization, and $1.4 million for the Barbara Roberts CTE project. There remain approximately $2,500,000 in funds that grantees have yet to spend down. And I am working with them and staying on top of what is, where they are with those in that process. This past summer also, the Yamhill County Economic Development Competitive Grants Program supported 8 businesses in Yamhill County with $125,000 in lottery funds distributed. The grantees' first report on their projects are due December 1st of this year, and their second report is due June 1st of 2025. With the economic development providers in the area, we are convening to collaborate on educational opportunities for businesses. This could include a Small Business Administration 101 program, access to capital, meet a mentor with the SBA and SCORE, amongst other topics. And we'll be discussing that next week to see what we can come up with that will help our business community. I meet with Business Oregon, Regional Solutions, MEDP, Chambers of Commerce, and the SBDC when possible, as those connections are helpful in assisting our business community by providing resources and connections for them to thrive. I strive to be informed on the issues of infrastructure, healthcare, water, sewer, childcare, and other areas of concern for our communities and businesses. I attended the Governor's Marketplace, where I connected with many state and federal agencies such as the Small Business Administration, WorkSource Oregon, Chemeketa SBDC, and attended a variety of workshops, including government contracting, Oregon Emergency Management, and small business access to capital. And as a matter of fact, there is a second one coming on Monday, which I am unable to attend, but they have another marketplace coming up on Monday. I talk and/or meet with businesses seeking assistance, anything from grants, planning, and permitting questions, tax and assessment questions, business resources, and connection. For example, I will be meeting with an expert in the Oregon Rural Industrial Tax Credit Program to discuss how the program could assist our local businesses. The Rural Industrial Tax Credit encourages business investment and growth and employment through a short-term tax credit. I worked tangentially with the City of Newburgh and our county assessor on the renewal of Newburgh Enterprise Zone. There is one business that is participating in the Enterprise Zone at this time, and they also received a grant from the county to expand their business. I will also be working with the West Valley communities and SEDCOR on the renewal of the West Valley Enterprise Zone that is scheduled for renewal in June 2025. For strategy 3, identify and commit resources that will invest in Yamhill County. Here are some ways I've been doing that. I have a toolbox of available business resources and connections to Business Oregon, USDA Rural Development, Regional Solutions, Mid-Willamette Council of Governments, Willamette Workforce Partnership, McMinnville Economic Development Partnership, the SBDC, and Chemeketa Community College, to name a few. I created an economic development newsletter that includes grant opportunities, legislative updates, and workforce information to our sister businesses. Anyone can sign up for the newsletter via the county website on the economic development page. Newsletters are usually sent quarterly, and I sent one out late yesterday. I attended the Oregon Infrastructure Summit presented by the Northwest Environmental Business Council and Business Oregon, which focused on the infrastructure issues Oregon communities are facing. I followed the economic development track, which focused on funding for transportation and roads, industrial lands readiness, and funding broadband deployment. Through attending this summit, I gathered an understanding of broadband funding and how the state plans to execute that funding, a deeper understanding of the lack of funding for our roads, and strategies to alleviate some of the barriers to industrial land planning. I attended the USDA Rural Investment Strategy Summit, where I connected with a variety of resources that can assist with bringing investment to Yamhill County, resources for cities and businesses through the USDA. Issues raised at this event centered around the creation of a resource hub that would help direct government, business, and residents to answers they seek without going through multiple levels of people to find an answer, and the likely answer could be the use of AI. There were also very interesting presentation on the Yoncalla Early Works Program, a free childcare program created in 2013 by the Children's Institute and the Ford Family Foundation. And it really has become a model for addressing rural childcare issues. Strategy 4, develop and support vibrant communities. I attended an Association of Oregon Counties meeting for District 6, which included representatives from Marion, Polk, and Yamhill counties, state legislators, representatives from the governor's office, and congressional staff. The discussions included the Oregon Behavioral Health Deflection Program implementation and funding from the 2024 legislative bill HB 4002. Contracts with Oregon health authorities, concerns funding the cost of healthcare for very sick inmates, opioid settlement funds, and community action agencies and elections. I attended the MEDP Workforce Integration Network meeting that is held monthly. It is a group of workforce development professionals from education and industry. The group is focused on growing the workforce through education and resources. They have developed a career website, Yamhill Valley Careers, a free job board for job seekers and employers, and that is currently being supported by Chemeketa Community College. I also meet with local, state, and state representatives. For example, I met with Representative Lucetta Elma recently to stay informed on legislative issues, grant opportunities, and other relevant issues impacting our communities. In addition to all of the above, I am actively following up on childcare-related programs such as the state's childcare infrastructure program and communications with recipients of the childcare program the county funded with ARPA funds early last summer. I stay apprised of grant opportunities for our county departments, for example, the Sheriff's Department, District Attorney's Office, and the Fairgrounds. Most recently, the DA's office and I have been in touch regarding a grant from the Federal Justice Department that we could apply for next year. Unfortunately, we started too late for that. I also worked with colleagues in Newburgh and the Willamette Education Service District to schedule manufacturing week tours for high school students in Yamhill and Marion counties. Through this work, it became apparent that many schools do not have the resources to cover the cost of student field trips, such as buses and substitute teachers. We are exploring funding ideas for next year. I'm staying informed on legislative issues. I attend business tours, such as recently we went to Cascade Steel and to Hampton Lumber, and most recently I attended the Oregon Business and Industry Road Trip, visiting businesses in Sherwood and Newburgh. Economic development is a broad subject, and there are many avenues to approaching the work. My goal from the beginning was to provide the county with a comprehensive approach, working with all of our local businesses and connecting economic development to our local government entities. In closing, I've taken a proactive approach to the economic development work for Yamhill County through understanding the concerns and issues in our region. I have developed connections across the region and a robust inventory of resources to help solve issues and respond to the economic needs of our community. I'm an avid reader and subscribe to a wide variety of economic development newsletters, federal and state legislative updates, federal and state agency publications, and chambers of commerce to ensure my resource list and understanding of the landscape for economic development is timely and applicable. Although economic development work does not always show an immediate return, the impacts of the investment over time can be significant. I am honored to do this work for the county and for our business community. Thank you for the opportunity to present to you today, and I welcome your questions.
Thank you, Joya.
Thank you.
Take a breath. You have done quite a bit of work in a short period of time and really hit the ground running, but I think that it's a testament to why we hired you for this position, because the work that you were doing at the MAC Chamber was phenomenal. We have a chamber forum tonight, and as a business owner and a former member of that chamber, I have to tell you that that was the only chamber that I actually looked forward to writing the membership check for and didn't hesitate because of the massive amounts of information that you were pushing out to business owners in the community and keeping them informed. And you've brought that here. So that's wonderful. One thing that I want to mention is a lot of this work is really paying dividends in terms of the discussions and the culmination of the discussions that we had at District 6. Because our regional representative, Beth Wojtowski, was there as well, downloading all of this information and now taking it back to the governor's office to communicate what our priorities are in this region, in this valley. So I spoke with her yesterday, and one thing that did come up as a question, I just want to mention it to you, and I think Director Manfred is also chasing money for like a detox sobering center, but they are very much aware that that's a priority for us, and it does bleed over into economic development. And was wondering if USDA grants, I know that's a part of your, a part of your toolbox, but if USDA grants would qualify for something like that. So maybe that's something you can look into.
I will research that for you.
Yeah.
There are so many USDA grants.
Mhm.
It's endless. And I have a very good connection with the regional director. So I'm happy to look into that.
Okay, perfect. Yeah. Commissioners, any questions for Joya?
No, I just want to say, one of the frustrations in the past is we didn't have, because I think Yamhill County is well known for being able, you can pick up the phone and you can actually reach a person and they always get to yes. I know our planning director has always said, folks come from other counties to do business here, to move here, to buy property here because they can get to yes through our planning department. And long before I was a commissioner, I thought, wow, you can actually get somebody at the county. So we kind of wanted that person who was the face of who do I call if there's an economic development thing. One of the things in the past I was concerned about is that not everybody was hearing about the grants available because it's sort of like the same people knew how it worked. But it was the little folks, the mom and pops, the food trucks, the folks who might not have English as a first language, who didn't know. You go to the website, you fill out I mean, it's not an easy thing.
Right.
So I've appreciated that. I've appreciated the newsletter because there's so much information. So thank you for doing that.
You're welcome.
And also that one of the things during COVID, you were really instrumental in getting our businesses lined up with what was going on at the state. So when you have that government connection where you know what's going on at the state, it makes it so much easier to navigate. So thank you for that. And thank you for being the person that we can go to when we have questions. It's been very helpful. And I think we've certainly gotten our video lottery dollars worth by having you
Thank you.
in-house. So thank you.
Thanks. It's been my pleasure. I would reiterate to you how hard everyone that works for the county, how hard they all work.
Yeah.
They're very dedicated people, and it is truly my honor to work with them on a daily basis. Planning department, finance department, HR department, you name it department, HHS, they're all great.
Yeah.
So it's good.
Thanks a lot for your work.
Thank you. Thank you for your time. Yes.
And I just want to say I appreciate how personal we have made this too. I mean, I just even this morning, I didn't call, I didn't email. I had questions running around in my head. I'm like, I'm going to go see Joya. She's in her office. Literally door was open and I just barged in, sorry.
It's okay.
And like,
We're
hey, just
here
a quick
for-
5 minutes that turns into a half an hour conversation. But I love the aspect of that to be able to just, when you got something roaming around your head, to be able to start planting the seeds for it. If there's any funding opportunities. So I appreciate that. Thank you.
I appreciate you. Thank you. Thank you,
Great.
all three of you.
Thanks.
Thank you
Appreciate
very
all
much.
do. Thanks.
Okay. That concludes our department update today. There is nothing on the work session and consent has, it looks like 4 sets of meeting minutes. Do I have a motion to approve?
So moved.
Any further discussion?
Done.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Okay, motion passes. Sure. Okay. Item H is old business. H1 is consideration of approval of amendment number 11 to agreement number 180033 between Yamhill County and the Oregon Health Authority for Public Health Services, Board Order 23-260, adding funding in the amount of $103,189. And this is continued from last week, October 17th of 2024. And commissioners, last week we had some questions about how the school-based health centers and behavioral health services and programming was actually happening in the community. There were some concerns that came forward with a recent tragedy. So I want to welcome Director Manfred up. We've asked some tough questions of her, and she has spent the last week finding data and information for us. So we really appreciate that. And then after Director Manfred presents, I will call for public testimony.
Thank you. After the meeting yesterday or last week, there were a handful of other questions that came via email. And so I thought providing just a little bit of an overview of the overall efforts related to suicide prevention in the county might be helpful as well. So that's what's in front of you. I'm happy to talk about that, but first, maybe I can just address some of the specific questions if that sounds okay.
Perfect.
So the funding stream at hand is new money. So I did want to provide that clarification. It's not replacing or supplanting the current 50-50 contract with the Newburgh School District. Instead, it is augmenting the services so that we are able to provide additional new services. So the funding itself is the $75,000 for this school year. After that, what we anticipate is that that $75,000 will continue, but will be over the course of a biennium. So that $75,000 will then be split between 2 years. So just, we have to keep that in mind as we're thinking about what we want to do with that funding, and we certainly are, and as well as having those conversations with the school to prioritize how they see that best used. The things that we can use it for are for things like drug and alcohol counseling and groups, mental health therapy and treatment groups, and then skill building, which is the same types of services that we're already providing with our 50-50 contracts. But again, this is new money that will allow us to add additional services to the Newburgh School District. The other 2 school-based health centers do have these mental health dollars already in their centers. Several years ago, the state legislature allocated funding for the existing school-based health centers in Oregon to have specific mental health dollars. At that time, the 2 centers that we had were in McMinnville and Willamina. And so those centers have these same funds helping us provide services there. After that funding formula was rolled out throughout the state, several additional school-based health centers were added, including the one in Newburgh. But at that time, they didn't have any additional funding, and so they decided to just leave as is, and that meant some centers had this mental health funding, other centers like Newburgh for us did not. And through whatever process I was not part of, they found additional funds, and that's where these funds came from. So just a little bit of context around the funds themselves. One of the questions I had was just to maybe provide some clarity on our role within the school, how that relates to other services in the schools, other partners in the schools, and then the schools themselves. So with both the school-based health centers and the 50-50 contracts, this looks the same. So when I'm speaking now, I'm talking about either one of those things. We provide staff that are on site at the school, depending on what the contracted amount is. For some schools, that is multiple Health and Human Services staff. For some schools, it's 1 day a week of Health and Human Services staff. They are our employees, so they're Health and Human Services employees that just deploy to the school and are there. Again, for some of them, that's where they report to work every single day, and that's what it looks like. And then for others, if we just have, we have a small contract in like Dayton, for example, we have a staff person who's in our clinic most of the week and then spends 1 day a week out in the school. So it looks a little bit different in each school, except that they are HHS employees. They follow HHS rules, policies, guidelines, all of those things. And then we provide the supervision over and oversight of that, certainly in conjunction with the school as we are working together. Those are separate from additional partners that are in some of the schools. Lutheran Community Services has some contracts, largely with the places that they are at the lower level elementary school level. That is separate from us, and they have their own contracts with the schools, but they do have some counselors in the schools. At Newburgh, there is a unique relationship with Providence Health Center, who provides, in addition to the physical health services for the school-based health center, they also provide mental health, behavioral health services as well. In addition to all of those things, each school is set up, uniquely with their own counselors, and what the role and scope of those counselors look like is I imagine similar, but probably has some uniqueness in each school setting as well. Those are separate services from what Health and Human Services provides. So at any given moment, right, someone I suppose could come into contact with any of those organizations within the school setting.
Okay.
So hopefully that answered the question just about the contractual relationships. I know that there was some specific questions about that.
I think so. I mean, obviously, it's much more complicated than we originally anticipated. But this particular item that we're looking at today had nothing to do with McMinnville School District.
Correct.
Okay, so those services have continued, nothing changed.
Correct.
No one was, no service provider was impacted. The school district, the counselors were not impacted
With the new funding.
with this particular item.
Correct.
Okay.
With the agenda item today, the only thing that changes is adding additional resource to the Newburgh
Newburgh School District.
School-based health center.
Okay.
Correct.
And the Newburgh School-Based Health Center covers all schools in Newburgh or just high school, all schools? Okay.
So school-based health centers are able to see anyone within the school district.
Okay.
So that would include,
Okay.
a parent could bring their kindergartner in for cold or something like that, all the way up to high school students, of course. Yeah.
Okay, thank you.
Couple of questions. And,
Absolutely.
thank you. Yesterday, we had a really good conversation. I think sometimes since I'm the liaison to Health and Human Services and I have the opportunity to have longer conversations with Director Manfred, I don't convey that to the rest of the board, but it's good that you're here. And we had this conversation yesterday because it really is kind of complicated when we're talking about Newburgh. Newburgh has the Providence piece of that at the health clinic, at the school-based health clinic. And then Lutheran has their nexus there. And not too long ago, there was a concern about one of the counselors there. And so we were able to address that directly with Lutheran. And I think what I've always believed is more information is better, because sometimes when we don't know how complicated these things are and we can't, Commissioner told me years ago, trust but verify. If you have concerns, ask the questions, try to get the data. More than not, we find that it's pretty much just, okay, now we understand how it works. So a couple of things. So regardless of who the provider is, though, whether it's Lutheran, whether it's us, whether it's a school, they have to abide by what the state requires in terms of parental notification. I know Dr. Turgeson that was a really helpful explanation of how everything works, which is really comforting, I would think, to parents. I hope that's what's going on in MAC. And hopefully you can address that. But so is that something that everyone has to have fidelity to? We can be assured of that?
So I will say for healthcare providers, we are all required to follow those guidelines and statutes. That would include Providence, that would include Health and Human Services, that would include Lutheran. The space in which schools operate is not a space that is familiar to me. So I think that would probably be a better question for schools in terms of what sort of statutes, if you will, they fall under. But for HHS, certainly all of the consent to treatment laws are things that we are obligated to follow. And part of those consent to treatment laws include parameters around parental notification, even in those youth who may be old enough to consent for treatment. There are still guidelines and parameters around when notification is required. And part of, in addition to the requirement around sort of a safety threat or concern for a youth, which exists, there's also requirements within mental health to, at some point in the service treatment, there needs to be parental or guardian engagement. So, that means that someone can come and begin treatment services with us, but at some point in that treatment, the expectation from the state of Oregon and per Oregon law is that parents are engaged in that process. It doesn't necessarily mean the very first time, but at some point during that treatment course, the parents are involved, unless there is some reason to to not do that because it would be detrimental to the youth. And so an example of that, and as I was looking through our own data to make sure that our team are, following these guidelines, one of the very few examples I saw was there was an open DHS child welfare abuse case involved. And so in that circumstance, right, the parent in that case was not notified.
Couple of things that you didn't add here that we're a pilot project, the opioid fatality review
Yes.
task force, and I'm on that, and it's been pretty effective to look at how do these things happen?
Yep.
And we're able to review those
Yep.
and with some specificity. Also MHDDAC, which when we meet quarterly, we look at all of those folks who have been engaged in services through your department.
Yeah.
Has there been an attempt? Has there been a completion? What led to that? So we're able to look at this with non-identifying information and look at what actually transpired. What could we do differently?
Yeah.
But not everybody who is seen at a school is seen through behavioral health through HHS. So you've got all these different providers and all these different places. And I think the question is really, how do we have that conversation with the schools to kind of make sure that all the boxes are being checked? But that's not your wheelhouse. But we still get those questions from the community, and
Sure.
it all kind of seems to fall on us. So we want to make sure we're trusting, we're verifying, we're answering the questions. And I think this has been really a good thing for the community to know how all this works, because it is very complicated.
It is complicated, but yes. And one of the questions also that I received was related specifically to the county's response after there is a death. And what does that look like? And what's our role in that? And we do have a role in that. So in 2015, there was a Senate bill that passed that required medical examiners to notify community mental health programs, of which we are that for our county. Anytime that there was a death by suicide in someone under the age of 24, they kind of capped that age, thinking it would be a capacity challenge for many counties and communities. Locally, we made the decision with our medical examiner that we wanted to know about every single time there was a death. And so what that means is every time we have a loss of life related to either suicide or more recently, there's been rules around overdoses. Those come to me and a small group of our team. That is whether they're an HHS client or not, every single name. So, which is not the most pleasant part of my job, certainly, but a really critical one. So anytime that happens, we have a process that I'll speak to in just a minute. But even before that notification sometimes gets to me, we have a notification that goes to our community outreach and support, our COS, sometimes called our mobile crisis team, and they deploy at the time of the event. And so they are there in the immediate moments for those loved ones, unless of course someone specifies that they're not interested in that, then we will leave. But we generally go out with law enforcement at the time of a death. Then after that, our team will do some strategic follow-up in the days and weeks and months after that. Again, unless the family lets us know that they don't need that, and that's okay too. That it's just here in case they do. So that happens immediately. Also, anytime we have one of those situations comes up, we will also deploy what we call our flight team. This can happen in a school setting. This can happen, we've done them in workplaces where there's been a loss, and just provide that sort of after debrief counseling, making sure that they know how to connect with resources if they need something more extensive than what we're able to provide in those days and weeks after something has happened. And again, those things happen no matter who the person is and whether or not they're service connected to Health and Human Services. That's something we would offer to anyone in the community, any business, any school. That's sort of for everyone. In addition to those things, when we have someone who, as you mentioned, either has an attempt or complete suicide, or quite honestly, just anytime we have what we consider a critical incident, and there's a lot of things that fall under that umbrella for us, we do a deep dive critical incident review that involves the entire behavioral health management team. And when we're doing those things, we're looking for any trends, any patterns, anything that seems like we can adjust our own system to say, hey, this could have been a different path. Hey, did we try this? Hey, what else could have happened here? And sometimes that's how we discover things like we have there's a gap. There's just not this service here, or we don't have a connection point to this place or these people. And so it's really a way for us to pull back and say, okay, how do we continue to improve our system as a whole? And that happens, like I said, with an array of things, including any attempt or any death by suicide. We also implemented, I want to say about 18 months ago, psychological autopsies is what they're called. So that is if someone does die by suicide, it's a deep dive into the circumstances that led to their death. And that is something that is a far more extensive process than the HHS process I just described. And it involves multiple partners. It involves law enforcement, the DA's office, medical examiner, family members, just sort of anyone who maybe have had contact with that individual. We have to, because of the extensiveness of that, it is only done with permission by sort of next of kin or the family members. So when we do get permission from the family to do that, we do that. And as Commissioner Starrett mentioned, we just recently began a pilot to model that same concept, but for overdoses as well. Some of the interesting things that have been discovered as places have done things like these I remember right when we were beginning, one of the stories that stuck with me was from a Washington County review. And we were in the process of learning about the reviews so that we could adopt the same process. And one of the things that they realized was there was a significant trend and pattern of people relinquishing their pets at shelters and before they would take their own life. And so it was that moment of realization that's not a partner we usually think about to say, hey, let's get some suicide prevention training to you, to your staff. What signs would you look for? Where would you send someone? How would you connect them with services if you were concerned about them? How would you even broach the subject if someone's really relinquishing their pets? And so those are the types of things that we look for when we do those deep dives, again, when we have permission from the family to do so.
Do you have staffing ready to go for this expansion for Newburgh?
It's a good question. Right now, we're still working with the school to firmly identify exactly what is needed. I think depending on the type of service, if it is things like the skill building and groups, yes, we would be able to do that. If it's therapy services, that gets a little more tricky, and we might need a little bit more time to make sure that we get that staffed up, because as the challenge with funding in this amount is it doesn't, we can't hire a full-time person for it. So sometimes it means just moving things around a little bit, adding a little bit of FTE here to try to build something up.
So, because I know there are issues trying to hire good people to do this work, because it's not easy. So I just want to make it clear, we didn't hold anything up. You're trying to get ready to do this when the funding becomes available.
Yeah, I don't think that there's a holdup. Certainly if it continues, we were not able to take our next steps, but you're correct that, I didn't have anyone ready to send to the Newburgh School on Friday, if that makes it clear.
Okay,
Yeah.
good to know. Thank you.
You mentioned that the funding would be over a biennium if it continues.
Yes, so
Okay.
this first 75,000 we are able to use for this year. It will expire at the end of this fiscal year, June 30th. And then after that, we anticipate another 75,000 coming to us, but being spread over the 2 years.
Specifically for Newburgh?
Correct.
Okay. So that's less money.
Yes. And that's
Okay.
part of our a bit of our challenge here is thinking about, well, what does that mean? How much FTE can we use? That's what, around 37,000 a year, which is a lot of money. And yet, as you all know, it doesn't go very far when we're talking about personnel costs. And so we're trying to be very mindful of that.
Okay. I remember several years ago, and Counselor Hollerman would remember this because I met with her and spoke about it, but there were a string of suicides in Newburgh High School. And the community collectively went, whoa, hold on, what's going on here? Let's dive in. The sentiment right now in the community in McMinnville seems to be tracking along the same level. And I think that's why when this came up last week, we sort of had that collective reaction. Whoa, let's check in because something's not right here. I spoke to a member of law enforcement yesterday who, and I'm going to generalize this, but basically said that anytime there's a child death, you mentioned under the age of 24, I'm just going to say child death. There's sort of two tracks where there's a criminal investigation, right? Identifying was a crime committed, what was the manner of death, and sort of making sure that that's solid in terms of the evidence of that, right? And then there's this other track, which is I think you mentioned it, the Child Fatality Review Board, which members of your team serve on, members of DHS, members of law enforcement, I think our DA's office.
Yeah.
So courts. And they look at every child death. So whether it was a car accident or it was a suicide, they're diving in and looking at that. I guess my question is, what, in a particular school where, this wasn't an HHS employee, it wasn't a school counselor that was maybe counseling this child, what is the authority of that board to sort of dive in and make sure that no matter what entity, so let's take Newburgh, you've got, Lutheran, you've got Providence, you have the school district, and you have us. There's at least four, to make sure that any one of those entities was not just following state law, because I'm going to assume that state law covers all providers and all entities equally in terms of the rights of the child and the rights of the parents and the family. But what's their authority to dive into that and answer those questions? Because the concern, and rightfully so, is that if a child at home is happy and there's no red flags and there's no signs, and yet that child goes to school and they literally cannot go to their classes and they're in daily crisis counseling, there's a problem. So who drills down into that and makes sure that we didn't miss anything? Do they have that authority?
So my understanding of, there's two different bodies of people coming together, I think, to look at these things. One is the Fatality Review Board that you mentioned. That is a statutory requirement of a community. I believe the statute falls under the DA's office, if I'm correct, that there is a requirement. And it's for everything, right? And so we review every single death, like you said, whether it's an accident, like a car accident or something like this. So in terms of, there's that, and then there's the one that I mentioned that does an even deeper dive specific to deaths by suicide or overdoses now. I am not aware of any sort of authority they have in terms of requiring someone or an agency or anyone to do something. I don't think that they have sort of governing authority or the ability to compel anyone or any organization to do anything. Certainly, we could review the statute around the Child Fatality Review Boards to make sure, but my understanding is that it's more of a recommendation type body where they do a review and they look for trends, they look for anything that could be done and make recommendations around this. I mean, the most notable ones that we honestly see from the Fatality Review Board are infant sleep deaths and car accidents. Those are the most frequent ones. And so, right, things like safe sleep campaigns get pushed out and things like that. So I don't know that they have authority to do something, but certainly I think that it could be a great use of time to say, to convene community conversations and groups to make sure that everyone has shared understanding, that, people have, whether you're in a school or a business or really anywhere in the community, have sort of the knowledge base and the tools to understand what is my role in suicide prevention, and what can I do when I'm in a situation where I'm concerned about someone. I mean, I'm certainly so proud of all of the work that Yamhill County Health and Human Services does. There's tremendous suicide prevention work from the upstream prevention all the way to the treatment and the postvention. And this is not a Health and Human Services problem in and of itself, and there's no way that just our organization is going to be able to solve this. This has deep roots in the community, and we need to be looking there. And so while those bodies I don't think have governing authority over any agency, I do think that it's a great use to be able to say, hey, these are some of the things that we've seen, and we want to talk about them as a community, depending on what it is that they're looking at, which would include schools, it would include families and parents and everyone else.
I think one of the great discussions that might come out of this is that perhaps we could at some point suggest to the school districts that they model after our MHDDAC, which does an after-action review of every one of these attempts or incidents. And really, you've got folks around the table. You've got a commissioner, you've got NAMI, you've got folks from your office. Everybody's in. You have consumers, you have folks that are there because they are struggling with behavioral health issues. So it's a really comprehensive group, and they look at everything that happens and says, what could we have done differently? That might be what comes out of all of this. And I'm sure that the folks in your department would be more than willing to sit down and show how we've structured that.
Sure. And absolutely we would. And again, the school realm is what I know of the school realm is as a parent. And so I don't have insight into what practices may or may not be there already, but yeah,
So
good conversation.
How long do you think it'll take for you to get somebody ready to go to work in Newburgh?
Well, so the conversations that I'm having currently with Jason, our behavioral health director, is actually looking at potential redeployment of someone that perhaps would be interested in that, at least as a partial. So I think assuming that all of that goes well, that could be a couple of weeks.
Okay.
Yeah.
Okay. Did you want to cover some of the more specifics on the suicide prevention?
I think we touched a lot on some of these. I think a lot of the postvention response outreach and support, right? That's very broad, but I think I dove into some of what that actually looks like, from the immediate response with law enforcement to the other pieces. I think one of the things that I will just note is the upstream prevention. I do think that there's such great research and information out there around things that we can do as a community to really pull together and prevent loss, prevent substance use disorder. All of these things, I always say that a good prevention program doesn't say alcohol and drug prevention. It doesn't say suicide prevention, because they really are programs that are helping build things like help-seeking behaviors, so that in this case, kids know it's okay to ask for help. They have already thought through who is a trusted, grown-up that I can go to when those things happen, and that we've trained those grown-ups around them to know what to do when things like that happen. And so I think there's a lot of work that is happening, and we need to continue, and we just need to keep building on and augmenting and growing.
Any questions?
I just want to say that the work that you guys have to see on a day-to-day basis, it takes special people to do that. And I just appreciate what you do and what the employees do for your department.
Yeah, thank you.
Agreed. And our sheriff's office as
Yeah,
well.
yeah, indeed.
Fire, paramedics.
All of them.
Well, I appreciate, last week we didn't want to just pull you on and try and have this extensive conversation. So I appreciate the time that you've put in, reviewing that discussion, and just, you live in this community. So I know you know what's out there and the emotion around this right now. So I just appreciate the follow-up and sort of working to understand, how we get to these tragedies, unfortunately.
Yeah.
Yeah,
Thank you.
Thank you.
Okay, so I think now would be a good time for public comment on this item. And I might have put these out of order, but I will call up Dr. Turgeson first. Oh, yeah, I think I messed them. Okay, whoever's first. And if you're online and you're hoping to provide public comment, I just want to let you know that we have, I think, 4 or 5 folks in the room, and then I'll move to online comment. Thank you. Welcome. If you could state your name and address for the record.
Elise Yarnell, 112 South Main Street, Newburgh, Oregon, 97132.
I am Tony Buckner. My address, I'm a school psychologist for the Newburgh School District, and my address is 64 Touchstone, Megaspiegel, Oregon, 97035.
Great, thank you.
Thank you for letting us come and share a little bit. And I want to start out by saying that I fully accompany Chair Burschauer in her comments of, I'm sure, where McMinnville is right now. And makes me kind of choke up. I just want you to know that my hearts and prayers are with all of you, and what McMinnville is experiencing right now, unfortunately, is why the 4 of us are here, is to show support for all of you, and that our belief as the providers in the school-based health center is that we work for you, and you have every right to question what's going on in our health center, in our clinics. And I know that Newburgh Dundee School District feels the same. And as a parent, I know you're a parent, I'm a parent. I would be horrified if I wasn't given the opportunity to be involved in my child's care. So I really want that to be heard from the 3 of you today. My name is Elise, and for the context of this conversation, I am here in my role with Providence. And so I am the Director of Access Strategies for Providence Medical Group Oregon. And one of my biggest pleasures has been to support the Newburgh Dundee School District. This is a highly emotional topic. I'm going to try to make it through this. But I really want to start by saying that this would not be possible without Tony Buckner. And he would never take that. But it's Tony Buckner, it's Officer Moreland, it's our school counselors, it's Dr. Phillips, it's Dr. Moreland before him, it's Dr. Kim before that. We have had a go at this in Newburgh. And your reference to this string of suicides happened in 2016-17. And that was my first interface with Newburgh Dundee School District, was getting a call with Dr. Turgeson in the back, who's a lot smarter than me. So her comment will be amazing. But from Tony himself asking us to come out as Providence because they no longer had access to their flight team. And so that was the initial entry of our relationship, and we just never left.
Links on that. During that time, that was one of my first years with Newburgh. I just want to make sure you can hear me. That was one of my first years with Newburgh School District, and to see suicide after suicide after suicide, and the team there within the district was stuck saying, what do we do? What is our answer in response to this? Because we can have as many flight teams as you want to have. There's no autopsies to talk about what has happened and how can we do it, because no one has the time or the knowledge to help. And so this is where we engage with our superintendent, who engaged with 20 local professionals, Providence Hospital, HHS, EMS, police department. Everyone's at the table there at Providence Hospital. We're sitting in a large conference room, and our superintendent at the time, Dr. Kim, pleaded and said something needs to change. Who's willing to stand with us as we develop a new system to make sure that we stop these suicides from happening? And for a while, it was a little quiet. I remember some uncomfortable times there. And we had two folks in the room stand up and say, we'll join in. And that was HHS and that was Providence. We got Lutheran on board shortly thereafter and our local police department. And within a time, we talked about how do we help support students that we can identify as having suicidal ideation. Because right now there really wasn't anything other than just a school counselor who was working isolated in a building and not talking to their colleagues because they don't know what they're doing either. It's what can we find off the internet to pull and screen a student and whether or not that's effective or not with zero supervision. School counselors are trained minimally in suicidal ideation and prevention. And so they're out of their realm in time to talk and combat suicidal ideation in the schools of what we're facing with our mental health crisis today. Bringing in the hospital, bringing in our HHS partners has created a very streamlined approach of how we tackle students who either express themselves or know of someone who's expressing suicidal ideation, and a response that is the same whether you're a 5-year-old kindergartner to a 21-year-old in an adult care in one of our transition programs. It's the same exact process. And parent notification, I just want to, and I've kind of written a letter in your packet about that. Parent notification was one of the most key factors in our program. So it was never one where it was intended to leave parents out. Everything about the school-based health center to our response to students expressing suicidal ideation has been in parent involvement. And now I can't speak to other districts and what they're doing, but I can tell you from experience of our own that this cannot be done with just the school district themselves. It has to be done in collaboration with partners and agencies around it. School districts are just not equipped, nor do they have that knowledge of what is happening and what our screening tool looks like, which will be discussed later on. We've spent a lot of time making sure that the questions we're asking, we're not afraid to ask, and then what do we do with it? It's never done in isolation as well. Once a counselor might be doing it, it always goes on to an administrator. And from a school district's perspective, I can tell you, when you ask the question about like who supervises to make sure parents are involved in this, these are my parents. These are, as a school district employee, these are my families. Like this isn't Lutherans, this isn't Providence's, this isn't HHS's. These are my kids. These are my folks that I'm responsible for. So after a counselor gives me the screener that says this kid's at a moderate to high risk for suicide, I'm calling to say, okay, I need to verify that my counselor isn't off base, that this truly is it. I bring in a specialist from either HHS, I bring in a specialist from Providence, they do a secondary screener and confirm and say, yep, this is where they're at. We need to do something. Immediately I'm on the phone with a parent saying, okay, we need to transport to the emergency room for a follow-up. We need to go do something different because right now your kid's at a high risk of suicide. Now, if they tell me, the screeners tell me, this kid is not safe at home, the parents are abusing the student, and this is what's driving that, there may be a cause. I can tell you in my 8 years of doing this work, I don't think I've ever had a phone call where I didn't make to a parent to say, this is where we're going and this is what we're doing. But you have to streamline the whole process. You have to make sure that as they're seeing a Lutheran provider, as they're seeing a Providence provider, as they're seeing their school counselor, everybody's in the loop on that. And so this is why we've mandated every 30 days, we have a significant case consultation where all of our providers come together in each individual building of our schools and talk about the cases where they've done those screeners. Every 30 days, we're asking questions. What does parent involvement look like? How is the kid doing? What kind of safety plan have we created? And is that safety plan effective? On every badge of our students, we see safety lines to report suicidality in their peers, to have anonymous tip lines, to have crisis tip lines. All of that is done because we're not afraid to talk about suicide. We've talked about it enough. It's a lot easier to do it before the student dies. And so that is an important part where I don't know what other school districts are doing, but Newburgh, we haven't experienced from 2016, 2018, we've had one suicide. And that suicide, we actually called for a flight team prior to the suicide even happening because we were worried about where is the kid at. We couldn't find it. We had already alerted police to say we need to do a missing persons report. We ended up finding that student up in Tigard, but we had a flight team already organized prior to that student actually being located and passed because we were so worried. We were already aware of what was going on. But it takes a whole community to make sure when you're doing this kind of work that it's not just one counselor working in isolation with no one else around, because that process, it didn't work in 2016 and it won't work today. So I just want to say I'm grateful for my friends in Providence. Grateful for Ms. Manfrin for all the work she's done. We've got some great and talented counselors who now have a direction and an understanding of what to do. The minute that we get a report of a student saying, I want to kill myself, which they say all the time. There's a lot of times where students will say, I want to kill myself. I want to die.
Yeah.
And we have to, we can't call parents every time a student says that because sometimes they may be joking. And so if we did that every time, then a parent's going, oh, that's the school calling again. My kid made some comment. We want to take these things seriously. And so there is a vetting process that we look at. And if a student is not a significant risk, if we've had all of our trained professionals say, yeah, I don't see this, we probably will not call parents every time a student says that, because there's some students that, you know, mess up at the recess. They didn't score a winning goal before they went back into school and they say, I want to kill myself. That's not would be overwhelmed with those kind of things. But when we start putting the factors together, when we start investing time to know our kids, to say, this isn't just a one-off comment, this is something that I'm concerned about, that's when we start involving our parents. It's all right. So I have a letter here that I've written just about our timeline. I've included our scope of services of what we do here in Newburgh. This is a PowerPoint that we presented to our entire community within Newburgh with timelines of where we started with and what we're doing. I have an opt-in form here so that this talks about when students come into our school-based health center, they cannot be seen unless parents opt them into the process. And that was something Dr. Turkson mentioned in her letter.
Mm-hmm.
Now, students 14 and age up, if they are seeking services by law, we have to support them. But every point of contact that we have with that student, that they say, I don't want to involve my parents, every time we meet with them, we come back, is it time to involve mom and dad in this conversation? So while they can consent to services on their own by law, and we have to treat them, we're always coming back to that conversation. This isn't just a one-off, you know, Mary, if your kiddo came into the school and said, I don't want my mom to know about it, and we never talk about you again, every time we're meeting with your student, your child, we're having the conversation. How do I involve your mom in this conversation?
And Jerry will go over those
Yeah.
specific numbers. I do just want to also end with saying, I would be honored if you would be willing to come out to the Newburgh School-Based Health Center at some point, anytime. And I would love to tour you through, meet all of the staff, and ask any in detail questions that you have.
We've talked a lot about concern of this school outwardly involving parents, but what's your process if you have parents approaching you saying, I'm worried about my kid?
Yeah. So those referrals, they all have to start with our school-based counselor, because we're not going to have Lutheran going around and trying to recruit kids to say, hey, come on into therapy. And we do the same thing with Providence or HHS. We cannot just simply have them come in. Now, if a parent were to go directly to HHS, to the fantastic therapist we have at the school district, and say, I want to engage my student in services, then that kiddo would come back onto our 30-day radar, where we'd let the school counselor know that that's what we're doing. We're involving another student in there. If a parent said, I want my student in therapy, we can start them in therapy, but eventually it will come back to the school counselor to do it. But
Do you mean
they have to
what's
elect
going-
into
if
it.
They want to know what's going on with their kids seeing a therapist? Is that more?
Well, if they're just concerned about their child in general, sort of reaching out
Yep.
proactively to you, I'm assuming, you know,
Absolutely.
Yeah.
you're there with services.
And we have a phone number right here where a parent can make a phone call and say, I'd like to have my student come in and be referred for mental health services. Just know that that doesn't land in isolation with their school-based health service. It will eventually get back to the school counselor to have that follow-up conversation. So it's not living and dying with only one person being invested in that student. Like, again, these are our students. And so we want to make sure that when a kid's investing in therapy within our school system, that the school is aware of it, and so that we can help treat and possibly support that student however we can. But in terms of, like, if a parent were to ask, like, what's happening in therapy, or if I were to ask, if I go into a student and I ask Dr. Turgeson, or at least, hey, what's happening with this student? You know, especially with drug and alcohol counseling, like that's a very protected class. And I have tried my very best as a person in the school to say, what can you tell me about this? And I get 3 answers. They're engaging in therapy, they're showing up to their appointments, and they're making good progress. That's all I get. I don't get, well, they're still vaping, or they're still using meth, or they're still doing this, and they had a big run. I get none of that. But I do get enough that I know I can plan and support the student in the classroom setting.
So you talk about that 30-day check-in.
Mhm.
You're not just waiting for 30 days before you revisit these cases. In other words, there's not somebody sitting out there with a critical, okay.
No, that 30 days is basically like, if a student were to engage in therapy and not tell the school counselor, for example, within that 30 days, Lutheran or HHS, whoever they're seeing would come back into that case consultation and let everybody on the school team know. And it's a smaller team, but it's one that would support directly those students. Now, if the school counselor referred a student to Providence or to mental health services through HHS, that's where we would talk and say, how is it going? But if a student came in and said, I don't want anyone to know that I'm doing this, our schools need to operate in a way where we can't operate in silos. And so we do share some of that information, but just understand it is on a case-by-case basis where the information I may want, I may not get unless it's pertinent to the school.
Do you have after action where you're looking at at a critical incident and looking at where the system might have?
We have a
Broken
flight.
down?
Yep, we have a flight. We don't have an autopsy like they had mentioned, which I think is a brilliant idea. However, we do have a flight team that helps families and the school act in a way of making sure, supports are there for other students. And HHS is always really great about that's not your.
That's not what I'm talking
Okay,
about.
after
Because I know our flight teams are amazing and I'm sure, once there's been an incident, that's great. But what I'm looking at is when we take a look at our critical incidents, we review them to see what could we do better? Do you have a system like that?
That's on the flight team. So after the flight team processes its information and gets all the information out within about 30 days, even less, most of the time, usually it's about a week, we come back to the team and say, okay, what do we learn from this process?
Okay.
What do we need to do? But
And also-
case specific is
The
different.
case conferences that we do, I mean, those are heated conversations a lot of times of, hey, we need to do this better on our end. We need to up our communication on this end. And the other point is that we were lucky enough to have an administrator, what's Katie's title? We have an administrative assistant from the school district at the school-based health center so that she coordinates directly with the school staff so that we don't lose track of a kiddo. So the second that someone's coming in, she's notifying the class and she's even trying to make sure that she's not pulling them out of core classes, that they're coming out of electives. And so it's been a really great partnership in that way as well.
Okay, thank you.
But in terms of like looking at a student's situation afterwards, after a suicide's been completed, I think that autopsy is probably our best bet to go forward on it. Newburgh's been lucky that we have only had one in the last 6 years.
One too many.
But it's one too many, always.
Okay, thank you.
Yeah.
Thank you both.
Thank you.
Thank you.
Do we want to, the sheriff is sitting there. Do we have to?
He said he was okay on time.
It's okay. Okay.
Hi, and Amy Stevens. I'm the Behavioral Health and Special Ed Coordinator for Newburgh Dundee Public Schools. My address is 14905 Southwest Woodhue, Tualatin.
Hi, I'm Dr. Jerry Turgeson, and my address is 912 East 3rd Street in Newburgh.
So what I'd like to share with you today is just a little bit about our risk assessments. Our risk assessments are a standardized process that we revisit and continually improve that include that parent notification piece. So as one of our school staff would likely be our school counselors complete that risk assessment. That is part of the standardized process so that they know to engage with the families in that way. And then they submit those risk assessments to an administrator team that's able to review them and be able to do follow-up and support. So that way we're ensuring that our staff aren't acting in isolation with tough matters, and that they have a partner to be able to do specifically for that specific student, or also just ongoing practices too around completing risk assessments. So that component of being able to connect with the family is a very big piece, and that's a part of what we do district-wide. We do provide professional development for our school counselors in this work, so that we're making sure that we're continually improving in how we're conducting our risk assessments. So. And also, as Mr. Buckner was sharing too, just within our case consults, we make sure to, on a monthly basis, revisit at per building for students that may have a safety plan or support plan in regards to having completed a risk assessment previously. And so we will then throughout that year revisit those specific students. And so what that case consult can look like is it's an opportunity for a school staff member to be able to bring forward to that team kids that they might be concerned about and want to make a referral for school-based therapy. It can also look like where a school-based therapist is able to share again with the school. So our work there is to make sure that we're all on the same page and being able to be just supporting one another from our lens of expertise and making sure that we all are able to address the needs of our kids together. So just wanted to share with you all a little bit about those processes and what that looks like.
Thank you.
Yes.
I get to finish us out. Thank you so much for having us today and giving us the opportunity to share about some of the work that we've done in Newburgh. As you all know, I'm Dr. Jerry Turgeson. I'm a licensed psychologist, and I'm currently here under my Newburgh School District hat today. So previously, I worked for Providence for 13 years. I still have a per diem appointment with Providence, but I practiced there for 13 years. And then the last 4 years, I served as one of 3 psychologist medical directors for the state of Oregon for that organization. And my heart, though, has always really been in Newburgh, and I'm very grateful that the Austin Family Foundation provided a grant to the school district that allowed me to step out of that healthcare administration role and back into serving the community that I'm really passionate and have the opportunity to live in as well. So while neither myself or the district were contacted to provide data specifically to you all about the work that's happening within Newburgh, it caught my interest last week when we were talking about school-based health centers and policies and services that are offered within the settings in the context of Newburgh specifically. So it felt really important for me that we could come and provide information specifically about how Newburgh is operating. Particularly given that our mental health services and the therapists that are working in parallel with Health and Human Services. And while I know Health and Human Services and us have different policies, I have been incredibly grateful for the collaborative relationship that we've had with Health and Human Services and the opportunity to partner in working to support our kids and youth in Newburgh for such an extended period of time. I became involved in the Newburgh-Dundee Public Schools, as has been mentioned, 8 years ago after the community tragically lost 6 youth to deaths by suicide within a 6-month time period. That's a really tragic experience for any community to go through, and my heart breaks for McMinnville that you all are having a similar experience. Our community rallied and partnerships were created between Providence Health and Human Services and the Newburgh-Dundee Public Schools, really with the sole goal of creating access to care, community education, and providing supports and resources to our community's highest risk youth. Since that time, myself and others have volunteered countless hours within the community and the school district specifically, developing standardized evidence-based risk assessment protocols. As was mentioned, school counselors don't have backgrounds in mental health. Some of them do, not all of them. And so we really wanted to make sure that we had a standardized approach so that every student was getting the same evidence-based comprehensive assessment, regardless of the school, regardless of the providers. And we were really able to meet those school counselors where they were with the knowledge and the background that they had to make sure that we were giving the highest base supports for our kids. Those risk assessments are then given to myself and Amy and Tony so that we can really monitor closely and make sure that those kiddos are getting the highest support possible in the assessments that done, and then the follow-up safety plans, which of course involves engaging our parents. We've provided teacher education. I think another really important component to this work is how do we educate our teachers, our janitors, all of these kids who have amazing contacts and amazing relationships with kids to know what their scope and their role is in supporting suicide and risk-related concerns. So you as a teacher can provide emotional support, you can provide encouragement, and then as soon as that word suicide is said, it is your job to take that kiddo and hand them off to the next person who can provide the level of assessment that that kiddo needs to make sure that we're getting them connected to the right level of care in the right space. We've done community education forums, and we really are continuing to work to expand the resources that we have available to the youth within our community. Something Tony said I think is really amazing, that the community, we are working on not being scared to say the word suicide because we have to be able to talk about it openly, to ask the questions, create the space to be able to get kids and families into the care that they desperately need. 2 years ago, under the stewardship of Dr. Stephen Phillips and our school board at the time, Health and Human Services, Providence, and Newburgh-Dundee Public Schools had the opportunity to open a full school-based health center to support both the mental health and physical health needs of our community. It's fair to say that there was community concern with opening a school-based health center. Our process, though, involved a high level of collaboration, community involvement, and compromise to ensure that we were providing services in a way that supported our community and feeling as comfortable as possible with the nature and types of services that were offered within the clinic. This included community forums, listening sessions, open houses, parent tours, and a variety of other means to ensure transparency in our process. I truly believe that our program is better and stronger because of the variety of voices that we had at the table and the perspectives and input that came together for a collaborative approach in how we moved forward to support youth and families in our community. I wanted to make sure that the information about the types of services and how services are offered was really clear. So again, while I can't speak to other school-based health centers or their policies or procedures, I really wanted to share about what Newburgh is doing. Our school district elected to have an opt-in process. What that means is that in order to receive services, as Tony mentioned, parents are completing a form opting their students in to receiving healthcare services through the school-based health center. If a kiddo shows up for care and doesn't have that opt-in form completed, the very first thing that our front desk staff does is, so glad you're here. Can we call a parent? Can we call a guardian to get this opt-in form completed? Our first point of contact is really making sure that we have parental engagement from the outset. Our medical providers from Providence have similarly committed to this level of parental engagement, and they are similarly having conversations with youth at every opportunity around connecting and engaging parents in care or guardians in care. We follow state laws around engagement of care, and the level of intention and work that both our school-based health center staff and our providers do to engage parents in care is a higher threshold than that required of any other primary care clinic, express care, urgent care, or emergency room or health center. We are truly asking kids at every point of contact, which safe guardian adult parent in your life can we connect with to make sure that family is involved in these processes. The goal for our school-based health centers are predominantly things like well-child checks, sports physicals, basic healthcare stuff like coughs and colds, and then mental and emotional health services. The clinic does not maintain or distribute any forms of medication on site. And based on comments made, I just want to make it really clear that we do not offer any sort of gender transition healthcare services or prenatal healthcare services. Those are not services that are offered within a school-based healthcare setting. Tony gave you all the PowerPoint presentations around like sensitive situations. That was part of our community forum, was like, here's a variety of sensitive situations, and here would be how we would handle those should that situation present to the clinic. So you all have a copy of that presentation that was done in a community forum setting, and that document is also available on the school-based health center website. There's also a kind of a helpful graph in there that really clearly delineates out, these are the services that we offer, these are the services that we don't offer, to help make sure that everyone can be really clear about those processes. So in addition to wanting to share some general operating information with you all, I'm a data person. I love data. I think it's also really helpful to give clear data around what our services are looking like. So youth are coming to us from a mental health standpoint for a variety of reasons: depression, anxiety, trauma, disordered eating, substance use, and then crisis risk assessments for suicidality. And our goal is truly to provide the highest level of support possible and partner with families or guardians to connect youth to higher levels of care when that is necessary. So the data that I'm going to share is specifically for the Newburgh-Dundee Public Schools and Providence therapists that are operating within the school-based health center, and those that go out to like our middle schools to provide services, kind of, but have the school-based health center as their home base. So right now, our crisis risk assessment referrals, so these are specifically kiddos that are coming to us because they have expressed high-risk suicidality or they need a crisis risk assessment. At this point, we have 100% parental engagement. Every single one of those kids who has come in for a crisis risk assessment with high-risk suicidality has parental engagement. In addition to that parental or guardian engagement, we strive really closely to coordinate with the schools where appropriate to support additional monitoring. If they're with me for 90 minutes doing a risk assessment and then they have an extra 6 hours in the school, but like I want to make sure that everybody in that kiddo's space who can be a positive protection for them can do within their scope, help to support safety monitoring. So that's going to be our school personnel when they're at school. It's going to be our families and guardians when they're at home, and making sure that we have a cohesive plan that can wrap around these kiddos. Since the start of the school year, I've been directly engaged in 11 acute risk assessments for youth, 3 of which occurred last week, 2 of which occurred this week. The week is not over yet. As I was leaving to come here, I had a youth, which again, I'm so proud, a friend, I saw them walking across the parking lot, brought a kiddo in and said, this is my friend and they need to be seen today. They're having thoughts of suicide. So the fact that our youth are able to do that, to provide that support for their peers, is essential. So I wanted to give just kind of a couple of scenarios around what parental engagement looks like, because I think I don't want there to be the misperception that it's just a quick phone call like, hey, I saw your kid today, just wanted to let you know. But we are really trying to be extremely intentional in engaging with parents, planning with parents, and bringing our parents in. So, flipped my notes around. So example, last week we had a youth who came in with suicidal ideation, plan, and intent. They had access to the method that they would use for how they were intending to end their life. Their plan was significant, and they were additionally having some really significant physical distress as part of their presentation. We called a parent, and that parent came into the clinic. We spent 4 hours together, safety planning, working to get high-risk items out of the home, addressing the underlying medical concern that was contributing to the distress. I was so grateful to have a medical provider on site that could help me with that, identifying supportive resources, and collaboratively developing a plan that the parent, youth, and myself as the provider all felt comfortable and confident with. Ultimately, we were able to land on a plan that everybody felt safe with and that everybody felt that it would be okay and safe to go home. Parent was confident, kiddo felt confident. And right now we have a plan that's connecting that kiddo twice a week for regular visits in the clinic. And we are doing regular, I've had 3 conversations with a parent this week specifically about that kiddo. Separate kiddo, beginning of this week. Again, suicidal ideation with plan and intent. Kiddo was very depressed, very withdrawn, was not able to engage in any form of safety planning. And so given the level of risk and inability of kiddo to engage in safety planning, we immediately called the parents and asked the parents to come in, or asked if they would like the school district to provide transportation. Parent was able to come in. Parent had a preference for the hospital that they preferred to engage with. And so we worked with the parent collaboratively to develop a safe transportation plan to be able to get that kiddo from the school safely to their hospital of choice. And so while it was really difficult and really hard, I think, again, we brought that parent in, gave them kind of voice and choice in how they wanted to navigate that process, and also made sure that that kiddo got to the higher level of care that they were able to have the needs for. For each of these types of crisis visits, it's not a quick phone call. It's intentional, thorough engagement around, this is what we're seeing, this is the risk factors, here's how we're working to support your child, and here are kind of what we think are going to be the appropriate next steps. Do you feel confident? Do you feel safe with this plan? How can we collaborate to make sure that we're doing everything possible to mitigate risk and keep this youth safe? This level of collaboration it's consistent with the law. So House Bill 3139 went into effect in January 1st of 2022, and it requires all licensed medical and mental health care providers to disclose information about a minor's treatment and diagnosis as clinically appropriate whenever there is serious or imminent risk of suicide. One of the curiosities I've had as I was prepping this is it doesn't say school personnel as part of this law. So Elise Yarnell knows Representative Scharf, and so we have actually outreached to Representative Scharf to initiate the conversation around, can we work to revise the statute or propose a revision to the statute that would allow, or that would include school personnel as part of the individuals who are obligated to report when there is serious and imminent risk. So as a licensed mental health provider, this law directly applies to me and it directly applies to all of the interns and behavioral health providers that I oversee. So this is the threshold that we are maintaining as a requirement. I would love to make sure that it similarly applies to school counselors who may hold a different licensure status. So that's a side note of something that we're working on.
I just want to clarify, the law is specific to the license.
So the way the law is written is it says licensed medical and mental health care providers.
Okay.
Yeah.
But doesn't mandatory.
Of which school counselors are, some are. So some school counselors may be licensed mental health providers. Some Amy, correct me because this is the school world. Some school counselors have an teaching license or administrative license,
Through TSBC with for a school license, school counselor license.
a school counselor licensure.
So they're mandatory reporters, which means they
Yes.
have to report a crime or abuse or something like that.
Yep.
That there's a carve out for,
That is my understanding. I'm also not a lawyer.
well, that's not good.
So,
Well, I think
it-
that's the gray area that prompted this conversation is
Right.
when do you,
So-
what's considered serious and who?
So that is the other thing is that the
Right.
law does not define what counts as serious. So that is based on clinical judgment. So for me, anytime I have a youth presenting with ideation, intent, and plan, that is serious. And that warrants parental engagement or a guardian engagement.
And I think that goes back to just the processes that we use through our case consults too, that we are bringing in both our building administrators, our school counselors, and our therapists together, along with our input, so that we are, as I mentioned earlier too, if we're seeing kids that are at risk, that we can at any point be able to say we need to make connections with the families and connections to a proper referral. But we intentionally do a review of the needs for the schools on a monthly basis. So
Thank you.
And for Newburgh, the standardized level 1 risk assessment that our counselors and administrators do explicitly includes parental involvement as a step in that standardized process. So I would love to see that expanded. I want someone with a legal background to make sure that my interpretation of this is consistent with how I'm seeing it. But right now it only says licensed mental health and medical providers. So I think it's an opportunity to expand collaboration. And I think one other piece, the 30-day consults, those are our standard on our calendar huddles. We are doing on-the-fly consultations daily, weekly, phone calls regularly to make sure that anything high risk is addressed real time in the moment to ensure that youth have the supports that they need.
Thank you.
So that's our crisis assessment and our high risk kids. I also want to just speak briefly to our therapy kids because we have parents who refer kids in, counselors who identify maybe a kiddo with depression or anxiety who are coming in for therapy. So right now, for our therapy patients at Newburgh, 90.7% this school of every child that has been seen and is openly active has parent and guardian engagement. That leaves 9.3% of our youth that currently do not have parent guardian engagement. All of these youth have had a risk assessment. That's a standard thing we do for any kiddo who walks in the door who asks for therapy. They get a risk assessment as part of that. And none of them have endorsed risk factors for suicide and have denied any suicidal ideation plan or intent. And that assessed risk has not changed. And we are actively working at every visit to assess parental engagement where we can. And the reasons we have currently for not involving parents for these kids is that they are kind of one of the following buckets: youth over the age of 18 or have been legally emancipated, youth identified risk or safety concerns related to parental involvement, which includes active parent substance use and addiction, physical abuse, emotional abuse, and unaccompanied houseless youth. And we have made CPS and DHS reports everywhere we're indicated, but those are the types of reasons where we have said at this time, it is not safe to engage parents in care. And so and as Director Manfred said, the goal is to include parents by the conclusion of care. So we are continuing to assess, continuing to talk through and continuing to work for that. But right now we have significant risk and safety concerns related to these kids. The partnership that Newburgh Dundee Public Schools has with HHS has been an essential partnership The resources that they provide really help to support accessible health services for youth and families, crisis resources, and help to support a wide variety of patient and family-centered opportunities to access higher levels of care. County has always been an incredible collaborator and resource. They always answer the phone. They have given me some backline numbers and are just such an incredible partner for us to be able to really collaborate and make sure that we're working together to meet the needs of our highest risk youth. Youth suicide continues to be a significant concern. As I'm sure you know, it has long been the second leading cause of death in Oregon for youth aged 10 to 24. Just want to pause. 10 to 24, those are fifth graders.
Thank you.
Our school-based health center has been an incredible component to addressing this within our Newburgh community. And with the good work that we've done, we still have a long way to go and a lot of work to do in supporting our youth. So my hope is that we can continue to come together as a community, uplift our youth, and ensure that we have as many programs and resources as possible to support these kids and families with the care that they desperately need. And thank you for your time.
Thank you.
Thank you.
Are there any questions? Any
No, I really
questions?
appreciate that. Very helpful.
Thank you very much.
Thank you.
I have some comments, but I want to make sure if there's any more testimony, either in the audience or online. And if you're online, please raise your virtual hand. Sure.
I just want to note, my interpretation of the statute that Dr. Turgerson mentioned around notification, my understanding is the same, that requires and is for essentially healthcare providers, if you will, like the licensed providers. However, I do think that, and so that wouldn't be applicable to school staff, but there are other statutes and rules related to schools. And so it would probably be worth doing some due diligence, and I'm happy to look at that and partner with our schools and just ask some more questions. I know most recently, I forget the bill number, it's commonly known as Addie's Law, went into effect, and it required schools to have a plan around this and to submit this plan, I believe, annually. And the requirements have a number of components to them in terms of what a school's response would be, should they become aware of something of that nature. What I am uncertain of at this moment in time, just because I don't remember every line of that statute, I don't recall if that does have some sort of requirement for notification of parents, but that certainly is easy enough to take a peek at and look at what the rule says. So I think, yes, my interpretation is the same thing. And oftentimes we see healthcare agencies and school statutes, they're just completely separate rules and statutes. And so there could be something under there, and it could potentially be part of this Addie's Law. And I'd be happy to take a closer look at that. Sure.
Great,
Thank you. Helpful.
Yeah.
Thank you.
What I appreciate is that it sounds like for Newburgh Dundee School District, there are no silos. The silos have been broken down and everyone is in the loop and behaving in the same way when it comes to parental notification, et cetera, et cetera. So regardless if you're a school counselor and you work for the district or you work for Providence, doesn't matter. Okay. I just want to say, first of all, I think it's critical for students to have access to adults in schools that they trust. And I want to acknowledge too that there are schools in our county that don't have these sort of sophisticated services. And you have administrators who are really filling those roles. And so, you know, I want to acknowledge that too. My son happens to attend one of those schools, and I have been talking to him a lot over the last week about, you know, who do you consider the counselor? Who would you go to if you were if you were struggling with something? And he was able to identify somebody. So that's amazing. So I want to recognize those people too, because they are doing this kind of work and they don't necessarily have the support system and the team. And I just want to recognize too, you know, when a tragedy like this happens, especially the one that happened recently that involves mental health issues, I think the adults in the community, the adults in the schools, people in positions of power, we have the responsibility to start asking questions And a lot of good came out of Newburgh asking questions back in 2018, 2017, 2018. And I am incredibly impressed. The pause, if you will, that we took last week had nothing to do with Newburgh Dundee School District, frankly. It was not a question of the efficiency of your services or even what you were doing and what you weren't doing. It really was, it stemmed out of a tragedy in McMinnville. And to be fair, McMinnville, we haven't heard from them. We don't know what they're doing. They could be doing very similar things too. So I want to be fair about that. But for your team to come here within a week and spend 2 hours almost with us and give us the amount of the depth of data and just context and reassure us. We're all parents and grandparents, some of us, and we take this to heart when this stuff happens. And I just am very impressed by your ability to come here with literally in a short period of time and provide all of this data and knowledge, and Director Manfred too, to be so responsive. These things come across our desks sometimes in an awkward way. OHA or OHA pass-through funding to HHS and then to school districts. It's kind of a clunky process sometimes. But anything that comes across our desk that requires our votes and our signatures, that is in our lane. We are in our lane. And we care about this. We didn't get elected just to be rubber stamps without asking questions to make sure we understand what we're doing, what the actual application of the things that we're doing and approving are. So I just really appreciate my colleagues too, being willing to take another week to dig down a little bit and get some data. I learned a lot today. So I really appreciate that. And it's reassuring as a parent too, and as a leader in the community, to be able to answer some pretty tough questions that are being asked right now in the city of McMinnville. Any further thoughts or concerns or questions that we haven't covered?
No, to your point, Chair, I think we have to be mindful of the fact that the role of the commissioners, I know in the past, there's been a lot of rubber stamping. It's easier. It doesn't take as much time. You're not up till 2 in the morning looking at contracts and spending hours and hours and talking to everybody you can to get all the information you can. It's been easier in the past for there to be a mentality of just rubber stamp everything on the agenda, and then it doesn't take any time and we can be out of here at 10:15. So I am grateful for a board that will ask questions. Every single one of us up here has put pause on one agenda item or another. I'm looking at Commissioner Johnston. And we've all said, wait a second, I don't understand this fully. Before we say yes for the community, let's make sure this is in its best interest. So today, you coming and the information has been really helpful. And I hope what this does is get everybody having the same kind of discussion. So appreciate your putting a hold on this.
Thank you. Any questions or?
No,
comments?
just want to reiterate, mostly what everybody said. And, even when this was before us last week, one of the main questions was, is this delaying services? And it was not. And then the next phase to that is, how quick can we address this? And I am super appreciative of everybody that's came and submitted comments and have spoke today, and very informative. And I thank you for that.
Okay. So we do actually have the agenda item. Is there a motion to approve?
So moved.
Any further discussion?
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. Great. Motion passes. Thank you.
Thank you all for coming.
Thank you.
Very
Thank you.
appreciative of your work.
And we do have an add-on item. I don't have language in front of me, but Christian, if you want to maybe open up the item as an add-on.
Turn it on. Yeah, so this is the second amendment to our existing agreement with MedHealth for the jail medical services. For an additional extension of 2 months to give us time to negotiate the terms and the conditions around a new agreement going forward. It clarifies a couple of items. One is the existing cap in the agreement, and the other one, there's a change to some added costs related to insurance. And if there are any questions, more specific questions along those lines, the sheriff and the jail captain are here and should be able to answer any questions.
Sheriff, did you have any comments you wanted to make, or you're just truly here for questions? And thank you, by the way, for sitting
Thanks for
for
waiting.
almost 2 hours. I know you also have children and also care deeply and have been responsive to these situations in the community, so.
Absolutely. Thank you. I know this has been before you previously. There's a couple of added benefits of doing this 2-month extension. Obviously, we know that we have to have a longer term solution, and there are some finer details that this will give us some time to work through the alignment of some of the other initiatives like the Medication for Opioid Use Disorder Grant Program, MAT in the jail, and how we can utilize the various providers, whether that be HHS or the medical services contractor. It aligns, for simplicity's sake, with a new contract starting at the beginning of a year, rather than having these awkward, like October 27th expiration dates. I think it makes it easier for budgetary planning purposes. So this is just continuing the service that we already have. The increases just are reflective of uncontrolled costs for us and the provider, which is their insurance that they have to carry for malpractice. And those rates, I'm certainly not in any position to speak to how those are determined, but I can only imagine that those vary wildly given whatever's going on in the world that they provide service in. So.
Commissioners, any questions on the extension?
Budget-wise, there is a big difference between the current insurance and what they're requesting, that addition. Budget-wise, how is that impacting you?
This particular increase for the insurance for the 2 months, we'll be able to absorb that just internally. The longer discussion about the contract itself and the renewal is what we spoke about previously, that Mr. Huffer is already working on, and ourselves. And this, again, does give us the time to look at how we can align some of those other opportunities to best provide service for the adults in custody and address the budgetary concerns.
Thank you.
Okay, so does this impact our notice of intent in any way? No?
No impact.
Okay, any further questions for the sheriff?
None.
So the motion would be to approve, is it amendment number 2?
Correct.
To the Yamhill County contract for correctional healthcare services, board order 23-315. No?
Like that. Well, the original
that the
contract
original?
was, 2375. Yeah, but yeah, the motion to approve the amendment to the agreement between Yamhill County and MedTrust LLC for jail or correctional healthcare services.
So moved. Any further discussion?
None.
All those in favor signify by saying aye.
Aye.
Aye. All opposed, same sign. All right, amendment approved.
Thank you.
Thank you.
Thanks, Sheriff.
Appreciate
Thank
your
you.
time. Thanks, Captain. Okay, any other business or add-ons?
Yeah.
All right, item J is public hearing. There's nothing today. Item K is announcements. Just really quick, we have the McMinnville Chamber of Commerce Forum tonight for county and the city of McMinnville race for the mayor race. So please join us for that. That will be over at OMI starting at 6:30. I think it's homecoming week this week, isn't it, for most schools? Anyway, happy homecoming dance and week and football games, if it is. I know it's YC, so. A reminder that our DA, Brad Berry, is retiring, and we will be wishing him well in his retirement send-off on October 30th. I think it starts at
3.
3,
Uh-huh.
but it goes after hours, 3 to
3 to
6. So pop on by and,
Over at the community center.
I think so, yeah. So just a reminder for that. And then, one thing that came up in our lipstick meeting yesterday was that the state has approved the first 3 of 9 Oregon recovery schools, recovery high schools. So there was a bill that was passed that would provide funding for and kind of fast track the process of those recovery schools. And they pulled Harmony Academy into their envelope of funding. So even though that one's already existing, they're now sort of considered one of the 9. And then there's one in Multnomah County, and there is one called Discovery School that is opening in the mid-Willamette Valley. So it'll be much closer to us, much easier for parents to access and transport their kids if their kids are suffering from addiction. And it sounds like that one will be open in the spring of 25, and it's going to be through the Willamette ESD, WESD. So I'm going to get some more information on just the specifics of that, but hopefully it's close by. And if it's not, we will be looking at being one of the other 6 schools. So much needed in our community. Those are all my announcements. I was going to give Stratus to one of you, so.
That's fine. You were so eloquent yesterday.
Yes.
You get to take Stratus.
Oh, well, thank you for that. It was a easy subject matter. The Housing Authority, which is an amazing organization, finally, ground was broken, but we had the official ceremony yesterday for 175 units over by the hospital, and it's going to provide housing for folks who belong to the tribe, who might work in McMinnville, and folks who are behavioral health through HHS might need a little extra supports and affordable housing. So appreciate the folks at the Housing Authority for that. And also want to say that I attended graduation for Adult Recovery Court. And we have, I believe, the oldest recovery court in the state. And we saw 2 people who'd been struggling with addiction since they were quite young, because I believe they were actually involved in juvenile drug court as adults and parents who had graduated and were moving on to share their strength and their hope to folks in recovery in the community. So it's always, I would highly recommend going to Adult Recovery Court, and the team over there and Judge Wiles, they do a wonderful job.
Great, thank you.
I got nothing.
Well, you were there yesterday.
I was,
Stratus.
but I was distracted.
He was playing with the shovels
Oh.
in the dirt.
There was just too much big equipment around.
Too many earth movers and
Earth movers.
bulldozers, but I appreciate all of the commissioners being there
Yeah,
yesterday.
It was good. Yep.
You were distracted. You wanted to get out there and play with the gravel
right.
pits.
Okay, anything else for the good of the order? All right, if not, I will adjourn.
Oh,
the-
one more thing. I would like to point out that Bailey who I don't know how you could help but notice, is expecting babies. Tomorrow is her last day here with us, and she is quite the trooper. And she gets the Employee of the Year award. But
Yep.
anyway, we will be missing you, and we'll be waiting to hear the blessed events.
Yes.
So all the best, and send us lots of pictures.
Praying for safe mama and safe babies
Yes.
in that process. Yep. Okay. If there's nothing else for the good of the order, I will adjourn the Yamhill County Board of Commissioners formal session for October 24th, 2024. It is 11.